Head and neck squamous cell carcinoma is the sixth most common cancer worldwide, with over 64,000 cases and 16,000 deaths annually in the U.S. HNSCCs are derived from squamous cells in the mucosal epithelium of the aerodigestive tract. The oral cavity is one of the most common subsites of HNSCC, with 25 to 60% of patients experiencing recurrence, a high incidence of 37,000 cases annually in the U.S., with a projected 40% increase by 2040. Some of the highest rates of positive margins for all cancer types and easy access for interventions. When removing these tumors, every millimeter matters. If the surgeon cuts too little, cancerous tissue may be left behind, increasing the risk of recurrence. Cutting too wide may damage nearby structures, impairing critical abilities like speech and swallowing. During the operation, the surgeon resects the tumor, adds crude manual markings such as sutures, and sends it to the pathologist who checks for cancer near its margins by performing a frozen section analysis. If the margins are positive, cancerous tissue may remain in the patient. In an operational game of telephone, the pathologist explains the size and location of the positive margin to the surgeon, who must map it back to the resection bed. Verbal communication is imprecise. The surgeon may miss the cancer by as much as 20 millimeters. This means that the positive margin position on the resected specimen is not correlated with the exact anatomical location on the tumor bed. The tissue can also deform, increasing the challenge. Although the surgeon removes tissue until the margins seem clear, the cancer is fully eliminated only 15 to 26% of the time. Hence, head and neck surgeons and oncologists need an accurate method to map the anatomical position of positive margins of oral cavity SCC back to the tumor resection bed in order to ensure successful re-resections and treatment. By leveraging 3D scanning and surgical orientation markers, our innovation can conservatively save the healthcare system $663 million per year, greatly reducing the substantial and underestimated economic burden of oral cavity cancer. After proven efficacy in the oral cavity, our solution can expand to use in other subsites within the head and neck and even other cancer types, specifically those with higher rates of positive margins. Along with the patients, head and neck surgeons and pathologists, as well as payers, will benefit from our innovation, which will improve margin localization, enhance communication, reduce repeat procedures, morbidity, recurrence rates, the need for adjuvant therapy, operating times, and the number of frozen sections. We are SurgeMap, obtaining negative margins to achieve positive outcomes.